Ladies and gentlemen, at this moment, let me introduce our first guest speaker. He is a professor at the Norwegian Center for Maritime Medicine at the University of Bergen, Chief Medical Advisor to the UK Maritime and Coast Guard Agency, and is currently a special advisor to International Labour Organization and International Maritime Organization, assisting with the revision of international guidelines on seafarer medical examination.
ค่ะและลำดับต่อไปนะคะจะเป็นการบรรยายในช่วงแรกนะคะจะขออนุญาตแนะนำประวัติท่านวิทยากรจากนอร์เวย์ค่ะท่านเป็นอาจารย์แพทย์สาขาเวชศาสตร์ทางทะเลสถาบันเวชศาสตร์ทางทะเลอาณาจักรนอร์เวย์เป็นหัวหน้าที่ปรึกษาหน่วยงานทางทะเลและยามฝั่งสหราชอาณาจักรปัจจุบันท่านดำรงตำแหน่งที่ปรึกษาพิเศษองค์การแรงงานระหว่างประเทศและองค์การทะเลโลก
He will be sharing his expertise in roles, responsibilities, and career paths of medical personnel with maritime medicine expertise, physicians, nurses, medics, and paramedics.
ท่านจะมาแลกเปลี่ยนประสบการณ์ในหัวข้อเรื่องบทบาทหน้าที่และเส้นทางการเจริญเติบโตในอาชีพผู้เชี่ยวชาญด้านเวชศาสตร์ทางทะเล
May I ask to give your full attention to our guest speaker and help me welcome him on stage, Dr. Tim Carter.
ค่ะขอเรียนเชิญดร. Tim Carter ค่ะ
And may I invite Lieutenant Commander Thanawat Supanitayanon, co-speaker for this topic. He graduated in Master in Maritime Health from University of Cadiz, Spain, Occupational Medicine Specialty from Chulalongkorn Hospital, and Medical Officer Underwater Medicine course from Australian Department Force, Australia.
ค่ะและขออนุญาตแนะนำโค้ชสปิเกอร์ผู้บรรยายคู่ขนานในช่วงนี้นะคะท่านคือนาวาตรีธนวัฒน์สุพนิทยานนท์ประวัติท่านวิทยากรนะคะท่านจบปริญญาโทด้านเวชศาสตร์ทางทะเลจากประเทศสเปนจบหลักสูตรแพทย์เฉพาะทางอาชีวเวชศาสตร์จากจุฬาลงกรณ์มหาวิทยาลัยหลักสูตรแพทย์เวชศาสตร์ใต้น้ำกระทรวงกลาโหมประเทศออสเตรเลีย
And now he is maritime physician, diving medical officer, and occupational physician, the Division of Underwater and Aviation Medicine, Naval Medical Department.
ปัจจุบันท่านดำรงตำแหน่งแพทย์ผู้เชี่ยวชาญสาขาเวชศาสตร์ทางทะเลแพทย์เวชศาสตร์ใต้น้ำแพทย์อาชีวเวชศาสตร์กองเวชศาสตร์ใต้น้ำและการบินกรมแพทย์ทหารเรือ
Please give a big hand to warm welcome them.
ค่ะขอเสียงปรบมือต้อนรับท่านวิทยากรทั้งสองท่านค่ะ
Good morning, Admiral, ladies and gentlemen. Today is, I think, a little different from yesterday in that almost all the sessions, this morning at least, are about training. And I want to introduce this topic in a way that I hope starts a discussion going. I'm not here to tell you what is right and what is wrong. I'm here to raise some of the issues about training in maritime health. And I purposely use the word maritime health, not maritime medicine, because it's not just about what doctors do. It's about what engineers do when they design ships. It's about what cooks do when they prepare food on ships for seafarers. It's about what happens in port welfare centres. It's a lot more than just medicine, which we're concerned about the health and well-being of seafarers. And I always find the best starting point in this sort of discussion is to try and ask, what are the goals of maritime health? Then to go on to what are the tasks that are needed to reach those goals? And finally, what are the skills needed to do those tasks? And so my talk is very much going to be about goals, tasks and skills to deliver effective maritime health services. I think one of the practical things, first of all, is what is maritime health? And I think it is something where there are a number of shared goals that if you talk to an executive officer in the Navy, if you talk to a ship owner, if you talk to a trade union official or to a seafarer, they will all agree that these are good things. Everybody wants healthy seafarers. First of all, are people fit to work at sea? And that has aspects which are both about the safety of the ship. Can the person see? Can they do emergency duties safely? And also about personal risk. How likely are they to develop an illness while they're at sea? And if they do, what are the consequences? And that's something that Alf Magna Horneland will talk about later today in terms of how you undertake the selection of people to work at sea. The second aspect, which we did discuss yesterday, is about managing medical emergencies at sea. This is about not just providing telemedical services, it's about the training that ship's officers have, it's about the medical equipment carried on board ships, it's about the telemedical advice, it's also about shore-based care and repatriation and safely getting people home if they're ill. And that is the next major topic, which is not what happens at sea, but what is needed if seafarers do become ill. Who provides the care and where, who rehabilitates them to get them back to work again, and who handles their repatriations if they can't rejoin the ship and go to their home country. The next important area is health, education and promotion. How do we help seafarers to lead healthy lives so they can have a full career and a happy retirement at the end of it? And that is, again, it's about a lot of different skills. It's about providing the right food, the right exercise, ensuring people have the right balance of rest and working duties over the course of their working week. Then the other next key one is safe and healthy working conditions at sea. And here it is not really a matter for the seafarer, it's a matter of well-developed responsibilities placed on the ship owner and ship operator to have a safe ship and effective safe working practices on board. Then there are risks to passengers. If you're talking about ferries or cruise ships, you may have a selected fit workforce on the ship, but you will also be carrying possibly old, ill, young passengers, and quite often they may be a far higher risk than the crew members. And then there's the very traditional core area of public health. What about infections on board ship? We heard yesterday about Legionella. What about the more traditional infectious diseases? How are you prepared for Ebola? How are you prepared for SARS? What arrangements do you have for handling infections? So those are all goals that I think everybody can agree to. The difficult question in maritime health is who pays the costs of doing this? Who provides these services? Are ship owners concerned about seafarers for the whole of their career or just for their current contract? Who bears the liabilities? If a seafarer gets injured at sea, who picks up the costs of their rehabilitation? And if they can't work again, who picks up those costs? Or do they just end up going back disabled to their families with no support afterwards? So everybody wants good maritime health, but often people are not prepared to pay the costs of providing it. And that's one of the key issues which I think we all have to face quite honestly. How do we make the case that it is worth putting resources into maritime health to avoid the often hidden costs of ill health in seafarers? I think a next and particularly important point to consider for you, and it's something which is quite important, you're all from a naval background. You're in the process of developing a set of skills which you're going to offer to the civilian population. And it's quite easy to think if you can do it in the Navy, you can do it in the non-naval world. And often there are very good practices in navies and other armed forces, but you're in such a different world when you go out into the world of commercial shipping or fishing. You haven't got a single national force concerned with security. You've got a lot of separate businesses, often only single ships, each of which is competing with the other to make money out of the vessel. And that's a very different world. Okay, that's a very different world from the world of giving orders that will be obeyed as in a military force. You've got to persuade, you've got to get people within a framework of law, you've got to get commitment from people to follow those requirements. And in essence, the civil maritime world is very international. Navies are national forces crewed by people of all one nationality. If you go and look at merchant shipping, except for very near coastal shipping, it has many nationalities on board it, people with different terms of employment, different patterns of ill health, different beliefs about their own health and how to preserve it. So that's an important area to look at. The civil world is concerned about markets. It's not concerned about warfare. Warfare is something it insures against or avoids whenever it can. Naval forces are equipped and kept for security purposes. In the civil maritime world, the age of crew members is greater than in the Navy. It's not young people at the beginning of their careers, except for a small number of officers. It's people who work right through their careers at sea. So you can expect to have more of the health and fitness problems that you have in old people than you do in the Navy. Also, the Navy has very often doctors or paramedics on board ships. The civil world has a ship's officer who's done quite a short course of training in dealing with medical emergencies at sea, and so is not nearly as well equipped. Also, navies, when they're not fighting, spend all their time training, and so all your people with medical responsibilities will have repeatedly simulated injuries, simulated illness, and how to handle them. That happens far less frequently in the civil world, and often officers are not nearly as well prepared when something goes wrong that involves an injured or an acutely ill seafarer. You're quite clear who owns your ships in the Navy. They're owned by the Thai government, and you're servants to the government. In the civil world, you will often find a ship is owned in one country, often a country like Switzerland or Monaco or somewhere which is a good place to own a ship in terms of taxation. It may be managed by a ship management company based, say, in Cyprus or Hong Kong. It may be operated with a crew from other countries. It may be insured in London. You will have a very complicated pattern of ownership and responsibility. And you have to understand that you're getting out of the simple world of state-owned ships into a much more complicated world if you want to do anything. Also, of course, you can run naval ships in one language with people all coming from a similar culture. You can't do that in merchant shipping. You've got a global workforce speaking many languages with very different cultures. And those are all things that, not to put you off, but if you are moving to provide a service away from the naval world, you've actually got to be aware of that. I know people like Thanawat are very well aware of that from their training and other things, but this is something that you collectively have to think about, how you address this different world. Now, I think the next point I'd like to make is not to be critical, but you have a huge hospital set up here. So I guess you all think in terms of health and medicine and maritime medicine being about what you do in this hospital. Most of what you need to do in terms of maritime health, as I would define it, is not about what hospitals do. It's about what you do to look after a population of seafarers. And again, your populations in the Navy are quite easy, defining the population. How many people work in the fishing sector in Thailand? Do you know? What are their relationships in terms of ownership of ships? Do you know? You've actually got to understand all that. But you need evidence about two things. First of all, what are the health problems that are experienced? What are the risks? What matters? Because maritime health is about managing and reducing risks to health. And the second thing you need is information about the effectiveness of what you do. What is it useful to do in terms of looking after the health of seafarers? Obviously, if there's an emergency, it's quite clear you have to deal with it and you're in familiar clinical grounds. But how do you make sure that people can safely work on board a ship? How do you make sure that people are not liable to become ill on board a ship? How do you make sure the ship is not carrying infections? Those are not hospital medicine skills. Those are skills of public and occupational health. And you've got to start thinking outside the hospital and in population terms to sort out how you deal with those. Now, what are the sources of evidence? I mean, the first thing, again, is most navies do have quite good information about the health of their crew members. They keep good statistics. They're kept in one place. They're very often analysed each year and presented to senior staff and to ministers, partly because it's important data, partly because it's what gets you the budget for the next year to provide medical services. The civilian world, any illness in a seafarer is just a misfortune. It's not something which is well recorded. So getting information on what matters for commercial seafarers and even more for people in fishing is difficult. You can collect some information from national statistics about mortality and morbidity. Knowing about the patterns of evacuations, repatriations and contact with TMAS services can be important. You can do particular studies of seafarer fitness and health. I think talking to your trainee working with you who's looking at fitness compared in shore-based and ship-based naval staff. That's the sort of good study you can do which provides you with pointers on what you should be doing about health promotion in future. You can look at other populations. You can often look at, in the case of the Navy, what the health problems in the Army are as well and see what's the same and what's different. Your experience with a well-documented naval workforce is useful experience in terms of what you expect to be the health patterns in commercial seafaring. You can also look at the general population and see if your common causes of death are arterial disease and cancer in Bangkok. Probably your common causes of death in seafarers are going to be the same. So you can extrapolate. Evidence isn't always very good, and one of the most unreliable sources of evidence is what is seen in a clinic in a hospital, because there are all sorts of reasons why people come into that clinic. from working at sea and just find they're denied any further jobs at sea. They end up back in their local community as people who find it very difficult to work without any real adequate care. And that's an important aspect for you to consider too, I think. So in terms of emergencies at sea, what are the skills? I mentioned we need goals, tasks and skills. Crew training in first aid and medical care, effective TMAS and search and rescue personnel. For instance, are the winchmen or other crew members of helicopters operating from here trained as paramedics? Are they able to deal with the acute management of emergencies and the difficult situation of a helicopter? If there's an onboard doctor, they obviously need primary care and emergency medicine skills. The one area where I think hospital medicine does come in is this one, because there will always be onshore clinical casework with ill and injured seafarers, and that will need specialist care. You need support for transport of seafarers. If you have a Thai seafarer who's got multiple injuries, say, who's in Hong Kong, arrangements maybe need to be made for an air ambulance or similar to bring them back here. What are the skills? Are there people who are available to escort them back again? And I think finally, this is perhaps the most central one for you to think about. Who is going to have the skills to integrate all these and to make sure there's a coherent system of work which can be applied for Thai seafarers of all sorts? The next area I'd think about in terms of what are the tasks are health education and health promotion. And one of the difficulties about health education and health promotion in seafarers, of course, is you've got to do it in two places. You've got to do it at sea, but also they have leave periods. And for instance, if you manage to control somebody's weight while they're at sea, but they then go home for a leave period and eat and drink and put the weight all back on again, everything you've done at sea is a waste of time. So you've actually got to think about how you plan health promotion initiatives that bridge over from both sea service and leave periods. You've got lifestyle issues. One of the unfortunate things about the seafaring world is that the common diseases of cancers and arterial disease in the developed world are now spreading worldwide, and one is getting those as being common health problems in seafarers coming from many of the major crewing countries like the Philippines in the way they didn't used to. So prevention there is about the difficult issues of lifestyle, weight, smoking, exercise, diet and so on, and all those need to be addressed for virtually all the world's seafarers. Now those aren't just about the seafarer, they're about food choices, food preparation. Most of the emphasis in seafaring has been on providing a diet with lots of calories in because seafarers work hard. A lot of seafarers spend much of their time sitting, doing very little. And so you've actually got to think about how you provide calorie-controlled diets for seafarers, as well as how you provide a lot of calories. So for this area, you need people with skills about delivering health promotion initiatives, and I know some of the people here are involved in it, and this is somewhere where often nursing staff, health psychologists and similar have a lot more expertise than any doctor ever does. And you've got to think about how you support programs of health promotion, and that involves not just health professionals, it involves getting the managers, executive officers in the Navy, crew managers in shipping companies and ship's masters in shipping companies, and also the peer group going. Because a lot of the successful health promotion in seafarers is about groups of seafarers all deciding they're going to not use the lift on board the ship, or they're going to run or walk and do competitive things to keep themselves fit and in good order. Next area safe and healthy working conditions. We've hardly talked about this, but my background's in occupational health, and clearly there are risks to seafarers from the work they do. A lot of attention also to ship collisions, ship groundings, loss of ships. But if you look at the modern maritime industry, injuries to individuals from falls, from toxic chemicals, from things like this, are a far commoner cause of death than ship losses. Fishing is probably the one exception to this. And what you've got to think about is a pattern of disease which is often not exclusively occupational. We think about risks like asbestos and noise. They're quite simple. One cause, one condition, and you can recognize it. But you've got to think about a lot of diseases that are made worse by conditions at sea, and particularly mental health problems, which are often a mix of personality, stresses at home, and the demands put on seafarers at sea. Now, we had the obligatory picture of James Lind yesterday about scurvy in one of the presentations. And just to bring you a little bit of British history on this, the Royal Navy, being a good military force, forced all seafarers to take lemon juice from about 1800 onwards and prevented scurvy. It was still present in merchant seamen 60 years later because there was not the discipline in merchant shipping. They bought the cheapest lemon juice, which often was adulterated with other acids, and they never bought enough of it. So you've actually, that's a very good little example. You can give orders in the Navy, and with any luck they'll be followed, to regulate something, and the end result in Britain was they actually had to introduce a government quality assurance scheme for lemon juice to make sure it had been prepared in the same way that the Navy prepared it. It took 60 years to get there. So you've got to recognize you're dealing with a different world. Other things, the classic problems I've mentioned, carcinogens, asbestos, and physical demands of work, also mental health problems. And here, maritime health needs the skills of occupational health. And it's very much a management-orientated activity about what are the standards for risk management, are they run well, have you got the right measurements of exposure, the right design of jobs, the right operational conditions for good mental health, and the right clinical skills, again, for recognizing occupational diseases when they arise. So that's another area which is part of maritime health where you need to think about the skills. Infections, as I mentioned, used to be the major cause of death and illness in seafarers. Less important now, but if you just look at how much shipping was upset by the SARS outbreak in Asia several years ago, and more recently by the Ebola outbreak in Africa, it can be very disruptive and needs to be considered. And there are well-regulated things in the international health regulations about this. But infections do still matter. Venereal disease still happens, HIV still happens, hepatitis B still happens. And these are classic public health skills, but they need to be applied to the maritime environment. Selection medicine. Alf Magna will talk about this later. But the key one is who can work safely at sea without risks to themselves or others. What are the practical ways of minimizing these risks by health assessments prior to work at sea? And a very important dimension, what is the evidence about the effectiveness of selection of seafarers? If you stop doing it, how much more ill health would you have at sea is a key question. What are the ethics of delivering sound decisions about seafarers' fitness to work at sea? Again, you understand this within a naval force, but you have to enter a bit of a different world when you're concerned about commercial shipping, the world of insurance companies, and other players in this. So here again, you need a mix of central policy development, but also competent doctors undertaking seafarer medical examinations on your workforce. Again, navies can do it quite easily. for the civilian workforce, you have to set the right policies for this centrally and then set up the mechanisms for doing so. So there's a diversity of skills. You need clinical skills for selecting people, for health surveillance, for occupational disease, for TMAS and onshore care. But you need non-clinical skills for developing policies, giving advice on health promotion, occupational risks and so on to companies and to trade unions and to governments and to insurers in a way that they listen to you. You've actually got to build acceptance that if you're running a service, other people accept what you give as advice as being good advice, and there's an important build-up you have to do on this. But also there are important non-medical things. Design of ships, the technical aspects of making them free of noise and vibration, creating good working conditions on them, procedures for avoiding exposure to hazardous chemicals, both when they're cargoes and when they're used on board ships, and also communication skills to set up the necessary links for TMAS services, for instance. So there are a lot of skills, but not many of them are the skills that need to be in a hospital. They need to be out there in the community, concerned about population health. Now, the next challenge, which Marit will talk about more, is how do you develop these skills? You've got traditional groups like doctors and nurses and engineers who have skills in their general training. How do you give them the specific additional skills they need to work effectively to help improve maritime health? What further training is needed? And do they need to be generalists, knowing about all aspects of maritime health? Or do they need, for instance, to know how they work as a TMAS doctor, or how they work as a doctor doing seafarer medical examinations, or how they work as a nurse running health promotion programs? You've got to ask general or special, even within maritime health. The second group where you need to develop skills are people already in the maritime industry who need training in some aspects of maritime health, because a good ship captain can probably do more for the health of his crew than a good doctor on shore seeing them, because he's with them all the time, and the climate on board the ship in terms of how it's run, what's eaten, are people encouraged to take exercise, is very much down to the captain. So you've actually got to think about how you train people whose primary job is a maritime one to know enough about maritime health to be able to play their part in delivering it. So you've got a professional training element for health professions, you've got a professional training element for seafaring professions, and you've got to bring those two together. Now, I think this brings us to what is the next discussion. Is there a valid speciality of maritime medicine or maritime health? Now, I'm not going to answer that, because I think the first thing to say is you need a lot of different skills and disciplines to provide effective maritime health care. You need, on the health professional side, primary care. A lot of what's done is general practitioner services. You need competence in emergency care. You need competence in telemedicine. You need competence in occupational health, which is both about clinical occupational health and the technology of risk management. You need public health and infectious disease competence, and you may have other speciality areas like hyperbaric and diving medicine where you need competence. Now, can you create a single speciality where somebody remains competent in all these fields? And I think that's a difficult question. Can you cover all these and, for instance, be absolutely up to date on emergency medicine, which may be the core thing you need? And I think this is the key discussion point. Is it more efficient to combine all these in a single speciality and have one person with knowledge covering them all? Or is it better to have a series of experts working together, each with their own speciality? Having said that, what I think is one of the key things, you need a directing mind somewhere at national level or at company level or at international level, working out how all these different aspects of maritime health fit together and making sure there's a good system that integrates them all. And that, I think, is the exciting thing, that you're just starting on a process of developing that. And I think what you've got to focus on is how you develop those core competencies of delivering a wide range of services which are needed to look after health. And it doesn't matter too much whether the person or the unit delivering them has all the skills, as long as they know what they do and they know what other people do and they can work together effectively. And in terms of this, you've got to think about a whole lot of things. How do you train people? Should you do it by bringing them in and teaching them? Can you do a lot by distance learning, providing material that people study on their own? How about structured learning while working? Apprenticeships and maritime training. A lot of that is about sea time, seeing what happens, knowing what happens, doing drills to understand it, and that may be more practical use than anything else. But also, you've got to think about informal access to knowledge. Where is the knowledge base? There's a lot of good information and a lot of bad information on the web about health and seafarers' health and how you get access to it. And another plug, I mean, you've got in the textbook of maritime medicine from Bergen a very good product for defining what is the scope of the subject and introducing people to the subject by reference to it. But training is not enough. You've actually got to think about how competence is quality assured and how effectively does completing a course make somebody competent. And I've had quite a lot of experience of auditing doctors doing seafarer medical examinations. And some of the best qualified ones are actually making more mistakes than some of the ones who simply follow a book of rules and do what they're told. So you've got to think personality can come into it. Some people are naturally happy to work within systems. Others, if you show them a system, they will immediately reject it and do their own thing. So there are a whole lot of... I'm posing questions, not giving you answers, but I think on my left you may have the person who has some vision about what the answers are for Thailand. Thank you.
First of all, thank you very